Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
Today in Neighborhood Health Watch, we're discussing an intimate makeover for women. And you men out there, stay close and listen also. More women are opting to have vaginal reconstruction and vaginal rejuvenation, and not for the reasons you might think. Some say having children led to health issues of the most intimate nature later in life, including stretching of the vagina, which can cause pain and discomfort performing regular activities. Dr. Nathan Guerette, Medical Director of Robotics at Johnson-Willis Hospital, and also the Director of the Female Pelvic Medicine Institute of Virginia, is here to talk with us more about it. We want to empower women with knowledge and options. Talk about this robotic surgery for vaginal tightening and what happens during this surgery.
So, in general, what these problems are laxity or loss of support in the pelvis, and that can manifest in a few ways. Loss of support to the bladder, vagina, or rectum, continence or control issues of the bladder and the rectum, and then also laxity in terms of sexual function is a big one as well. For bigger problems, we're using robotic surgery now to treat these issues in the operating room. This has changed these surgeries from being large open procedures that require many, many hours of surgery and many months of recovery into a surgery that's less than half that time, and they go home the next day.
Now, how can this type of surgery, the vaginal tightening and reconstruction surgery, how can it enhance a person's life and correct those problems?
Well, what it's doing is returning support back to normal in the pelvis. So that will return vaginal function back to normal, bladder function back to normal, rectal function back to normal. So in terms of daily function, you don't have to worry about where all the bathrooms are. It also helps with pain with sex and enhances feeling during sex and works with the rectum as well in terms of better control.
Is it covered under insurance?
Those are, yes. Those are.
And who should perform this type of surgery?
So I'm a fellowship-trained urogynecologist and pelvic reconstructive surgeon. For these more complex procedures, that's the type of physician you should be seeing.
Thank you very much for sharing the information. We appreciate it.
Happy to be here.